23 years old who plays rugby for a hobby, present with recurrent anterior dislocation of the shoulder. Which of the following abnormalities most likely to be present? This accounts for. That means a patient or a person who is frequently development anterior dislocation of the shoulder. What is the cause? Here the options are the rotator cuff tear, biceps tendon rupture, Bankert lesion, axillary nerve injury, infraspinatus tendinitis. So what may be the cause? First of all, let's see, this is the lesion which is the heel shank lesion. So first of all, in the glenohumeral joint, there is one important type of abnormality which is the heel shank lesion. In case of heel shank lesion, it is the posterior dislocation, but in this question there is anterior dislocation. So there is two important dislocation. One is the posterior dislocation, posterior and upper part, posterior and superior humeral head. When there is the dislocation occur posteriorly and superiorly, then it is the heel shank disease. Here we can see in this area. So this is the heel shank disease when there is posterior dislocation and superior dislocation. So superior and posterior dislocation, they are known as the heel shank disease. It may be chondral and osteochondral, and it is based view on the internal rotation of the anterior posterior view. And in this figure we can see this is the upper part of the humerus and it is dislocated from the glenoid cavity, and it is known as the heel shank disease. So let's see the heel shank disease. The impression fracture of the humeral articular surface caused by translocation humeral head over the glenoid rim. It found anterior 85% of anterior dislocation and 20% of the articular surface. And so the heel shank disease, actually it is the upper part of the humerus. This is very, very important. It is the upper part of the humerus. On the other hand, the Bankert lesion, it also lesion of the shoulder joint, and it is the anterior inferior glenoid labrum involvement. So it is very, very important. This is the anterior and inferior glenoid labrum. So when dislocation occur anteriorly and inferiorly, it is due, the lesion is the Bankert lesion. The lesion is the Bankert lesion. And when there is the upper part and posterior part lesion, or upper part and posterior dislocation, in this condition it is known as the heel shank lesion. So heel shank, it is the upper and posterior, and Bankert, it is the lower and anterior. And here we can see this is the lower part of glenoid labrum. It is torn, and for this condition the inferior dislocation and anterior dislocation of the humerus occurs, and it is called the Bankert lesion. So the Bankert lesion, it occurs due to inferior glenoid labrum tearing. So what is our answer? As the anterior dislocation of the shoulder, anterior and inferior, it is always goes for the Bankert lesion. Other options such as the rotator cuff tear. If rotator cuff tear, in this condition the shoulder movement, especially the shoulder abduction, will be lost. And biceps tendon rupture, we know the action of the biceps tendon. The biceps tendon, it is responsible for the flexion of the elbow joint, so the elbow joint flexion will be lost. And axillary nerve injury, in case of axillary nerve injury, there is also the abduction will be lost, and the sensation of the badge area also be lost, because the axillary nerve, it supplies the sensory sensation in the badge area of the arm and the muscles around the shoulder joint. And the infraspinatus tendinitis, in case of the tendinitis, there is the inflammation of the tendon but there is no dislocation, but in the x-ray there is the anterior dislocation of the shoulder. So our answer is the Bankert, because the Bankert, it is occurs in the lower part, dislocation occurs in the lower part or inferior part and anterior part, but in case of the heel shank, it occurs in the upper part and the posterior part.